Hi, welcome to my presentation on oral health care. I've titled this Completing the Puzzle because it is a great big puzzle that we need to complete. The missing pieces that we have are socioeconomic issues, lack of community programs such as fluoridated water, lack of transportation to and from the dental office, even lack of work flexibility, not being able to get off work to go to the dentist. Physical disabilities and illnesses prevent access to the facilities. Sometimes you just can't get in, or there's too many other diseases out there that could be considered detrimental to one's health. Lack of financial means or dental insurance, and even lack of public awareness and understanding of the importance of health care. Now, the CDC Strategic Planning for Oral Health addresses most of these. Lack of public awareness and understanding of the importance of oral health care and lack of financial means or dental insurance is covered under their initiative, which broadens the understanding of health disparities, determinants of health disparities, and evidence-based approaches to addressing disparities in oral health. Socioeconomic issues affect more non-Hispanic African Americans than non-Hispanic whites. And even preschoolers from low-income families have 3 times as much untreated tooth decay than higher incomes. The lack of community programs such as fluoridated water is addressed under the initiative that assesses the impact of increased dental public health infrastructure and capacity on the state oral health program effectiveness, efficiency, and sustainability. The state oral disease prevention program is one that is in effect that the CDS is providing nearly $30 million over 5 years in cooperative agreement funding to 21 states. The period of performance is September 1st, 2013 to August 31st, 2018. This funding will enable them to strengthen their oral health programs and reduce inequalities in the other oral health of their residents. This does include fluorination programs. Now, the lack of transportation to and from dental office and the lack of work flexibility goes under the initiative of improving the organizational capacity and functioning of the oral health program, with an emphasis on increasing leadership effectiveness, partnerships, and workforce development. Partnership approaches may include developing new organizational relationships, such as with the school nurses, to target populations at high risk of oral diseases. That would be the end of our part 1. We will continue to part 2 in just a moment. Welcome to part 2 of oral health care, completing the puzzle. Oral health care has strategic initiatives of the Oral Health Program 2011-2014 coincide with the goals of the Healthy People 2020 program. Oral Health Program specifically lists each area of oral health, where Healthy People 2020 condenses the goals into broader categories. As you see listed on the screen, you have the goals of the Healthy People 2020. There are 4 main goals of this program. Goals of Oral Health Program Strategic Plan 2011-2014 goes into more specifics, such as prevent and control dental caries across the stages, prevent and control periodontal diseases, prevent and control oral and pharyngeal cancers and their risk factors, etc., etc. As you can see on the left-hand side, they condense these, such as in achieve health equality, eliminate disparities, and improve the health of all groups. That covers all 3 of the previous mentioned goals of the plan 2011-2014. Here you will see the actual disparity. It is one missing puzzle piece of the oral health care across the nation. As you can see, I have broken it down into age, sex, race, education, marital status, full and part-time status. Workers aged 16 to 19, of course, had the highest disparity, the lowest income that I can account for the lack of oral health care. Those with less education have a higher disparity. Now, oral health care, what's being done about this disparity? The CDC actually monitors the disparity. The CDC also provides information to public health practitioners, dental care professionals, and policymakers on effective approaches to reducing and eliminating the disparities. CDC provides the information where Healthy People 2020 actually supports and enacts some school-based dental sealant programs, which provides sealants to children who may not receive routine dental care. This includes children at higher risk for tooth decay, those from low-income families, and certain racial and ethnic groups. The Healthy People 2020 objective is also moving towards its target of 79.6% of community water having fluoride. These are programs that they help enact, where the CDC actually reports on them. Will the puzzle be solved for oral health care? We will always have disparity among the U.S. population. The key is education and awareness. It's going to take teamwork to solve this puzzle. Thank you and have a good day.